Welcome to Samba Samba. Enjoy the video.
You start by confirming what you're treating. See a dermatologist so you know these are syringoma and not another condition. Once diagnosed, review medications and allergies with your clinician because some procedures require pausing blood thinners 5 to 7 days. Make sure to photograph the area for tracking. Clean the face with a gentle, non-irritating cleanser and avoid exfoliants for 48 hours so the skin baseline is intact and the practitioner can plan precisely. You and the dermatologist then choose an approach based on depth and skin type because treatment impacts scarring risk and recurrence. Discuss topical retinoids for conservative reduction versus laser or electrosurgical removal for faster clearance. Ask for a patch test when appropriate. Make sure anesthesia and session count are agreed and get clear expectations on downtime and costs. Once planned, have written consent and procedural photos so you both track results and manage recurrence later. After treatment, you protect the healing skin. Cleanse gently, apply an ointment if prescribed, and use broad-spectrum sunscreen SPF 30 or higher daily because UV increases scarring and pigmentation. Avoid picking or abrasive products for 2 to 4 weeks and follow scheduled follow-ups to monitor healing. If you see signs of infection, increasing pain, or abnormal scarring, contact your provider immediately. If lesions recur, reevaluate with your clinician, sometimes combining modalities or.
Thanks for watching. Consider subscribing if we helped you.